Terrific. Well, let me take this opportunity to welcome everyone to this town hall, and I'm looking forward to sharing. We're all looking forward, actually, to sharing the results of our workplace wellness survey, and more importantly, I think to kind of set a context around wellness and well-being as we move forward. The University of Guelph, as we all know, and we say it in different ways in our various roles, is committed to supporting the whole person. And it's interesting. I met with a couple of, I think it was the Saturday before last. I met with the incoming presidents and chancellor scholars. These are young students who have been selected for possible recipients of the President Chancellor Scholars. And one of the things that I said to them in my comments on that Saturday is something I think that's relevant today. One of the points of pride, I think, for the University of Guelph is that we're, of course, incredibly proud of our academic and research and scholarship commitments, and we're a cutting-edge university when it comes to our standing in the academic space, on the one hand. On the other hand, we're also a place that strives to be incredibly supportive, thoughtful, compassionate, thinking about each other and supporting each other in what I would say is an increasingly tough environment. There are so many pressures that are emerging, many of which are actually outside of our control, and they impact on us directly and as well as indirectly. So that balance between, on the one hand, being a cutting-edge academic, top academic institution rated among the very top comprehensive universities in Canada, on the one hand, and on the other hand, being a thoughtful, caring, and compassionate place is something I think that's special, that we strive for, and it's that balance. I know that the students, I found that the students really responded to that notion of balance, and I would say at a very practical level, that balance is actually a competitive advantage for us, because today, more than ever, that interconnectivity, that ability to work with others, to connect with the different groups and to support has never, I would say, been more important. So all of that to say that our Wellness at Work survey is an expression of our commitment to wellness and well-being and more. It's a lens for us that will help us identify areas of strength and areas and opportunities for us to better ourselves and to continue moving forward in. And I've got my eye on Sarah there, and thank you very much. This second slide here, the Okanagan Charter. For those of you who are wondering what is the Okanagan Charter, this is a charter that came out of the convergence of a number of universities coming together, committed to promoting healthy workplaces and supporting our people, quite simply. And last year, the University of Guelph became one of a group of Canadian universities to adopt the Okanagan Charter. And it really, again, it's a bit of an anchor for us and a reminder for us of the importance that we place on issues concerning wellness, and that we are working together and thinking about these issues in a broader context with universities across the country. I do want to take this opportunity to give a shout out to the team here. I want to recognize the support and the leadership that Don O'Leary has provided here, our Vice President of Finance, Administration and Risk. I got to tell you, the title's a little boring, but this is all about wellness today. And I think the fact that it's finance, administration, and risk that is thinking about wellness, I think is significant for reasons that I've just been mentioned. So thank you to Don, and really a shout out to the entire team. And the names are all there. The committee has broad representation, really, to make sure that we get an array of perspectives. And I'm a big believer and big fan of perspective taking, and looking at problems that, even if they appear simple, they often aren't so simple, and being able to have those different lenses is critical. We all have different working environments. We all have our own stories. We have different needs, and we want to develop programs and supports that speak to that array, that breadth of realities for us when we think, as we think about wellness. And in order to do that, we first need to know what you need and what you value. And in many ways, that was what the survey was about. And we also want to know how to better promote existing programs and services. So if we think about our strategic framework, wellness at work here reflects our own unique campus culture and values. And I have to say that process working towards that framework was a very energizing one for me. It was actually a journey that helped me more deeply understand our own community. And those values in many ways underlie the energy that was behind the Wellness at Work initiative. And we have examples of I think outputs, institutional examples of successes, and including remaining an employer of choice, our known support and commitment to the whole person, recognizing the importance of campuses, facilities, and services, and really in building a thriving university community. And all of that as we continue to try to recruit and attract the very, very best to keep this university positioned where it is. And finally, I would say about listening. Listening is not passive, it's active. It requires effort, it requires moments of pause. And again, in many ways, this exercise was an exercise for us, certainly as a listening exercises. And in that regard, for the survey, we worked with Vancouver Psych Health and Safety. They are leaders in workplace wellness surveys and have worked with many other organizations. And I know that we have with us today two of the members of it. I'm going to mess up on your names, but maybe Dan and Merv. Yeah, Dan and Merv, and both excellent leaders, psychologists that have taken their psychological context and put it to great work in the on this survey tool. And the survey, I would say, is a snapshot. It's a moment in time. And that's something for all of us to remember. These things are dynamic. They evolve. They change. They're a function in part of the context of the broader environment within which we have to work. They're also a function of internal challenges that we have to work through, and internal opportunities. So it's a snapshot. It's a moment in time, and it's a starting point. A starting point that allows us to have a baseline to understand who we are now and against which to measure our progress. We expect to repeat this survey every few years after we've had time to implement some of the changes or build on some of the opportunities that come out of the results. And so all of this is really about adaptation, adapting to change, continuing to move forward, continuing to adapt and align ourselves with the realities of our environment and the realities of the day. Important to stress, we value everyone's input, and we're grateful, very grateful for everyone who made time to take the survey. And it really does show the commitment that this community has, and in terms of wishing to continuing to improve. But I would also add that a community that is committed to supporting each other. So it's not just about us as individual groups or individuals, but also supporting each other and understanding the challenges and opportunities that others face. And it's, again, a bit of an exercise in perspective taking. So on that note, I think, again, I'm going to just say thank you to all of you for being here. It's a great turnout, and it's a great use of this Peter Clark Hall, I should say. And on that note, I'm going to turn it over to our Vancouver Psych and Health Safety folks to talk more about the survey. Thanks very much.
Thanks very much for those kind words. It really is a privilege to be here and to see all of you here and to work with the University of Guelph. Mostly what we're going to talk about is really a good news story, but we're going to point some areas of concern as well. Next slide, please. As pointed out, Dan and I are psychologists. Therefore, we went to school for a long time. We also worked in healthcare for a long time. So we have considerable experience with complex organizations like universities and healthcare systems. And there's some interesting parallels there, by the way. Amongst the things we have done is create a number of tools and resources and done research on behalf of a number of groups, in particular the Mental Health Commission of Canada, that have championed this issue of workplace mental health across the country. So it's been a real treat to move forward on that. Anything you want to add?
And there's a very nice analogy between what we have done as clinicians in the course of our few decades each of clinical work and what we're doing here, because to some extent when we assess an individual to see what that person needs to change and where the possibilities are for change in a positive way, is not unlike what we do when we work with an organization. And in a sense, what we're doing then in a similar way is doing an assessment of where the issues are, where the possibilities are for positive change, how might that move forward? And that's not a bad expression of what this survey has actually been meant to do here. Where are the opportunities for positive change and what might that look like?
As mentioned, Dan and I are both psychologists, and it's a little weird, but in our collective agreement as psychologists, we're obliged to quote Freud. I'm sorry, I don't know why. He was a funny guy with some funny ideas, but I think some great wisdom, and this kind of paraphrase quote reflects one of them. I think it's really important in all these discussions to remember that work can and should be good for our psychological health and safety. A good, healthy workplace, a psychologically healthy workplace provides us opportunities to learn new things, to grow, to develop new skills, to have a sense of identity outside of one's personal life and family, to hopefully get dressed and shave and shower and go somewhere in the morning, to interact with people beyond your family. So work can serve all those purposes for many people. And I think trying to keep that frame, and that's the frame in the survey, as well as that kind of positive mental health, or more importantly actually, positive psychological health context. So what we did, as mentioned, we have done a lot of work creating various kind of tools. One of the tools we've created over the years, something called Guarding Minds at Work, which is a survey, an employee survey, and some other tools that takes the perspective that someone working in a particular work environment is an expert in their job, in their context, on what it's like to work there. No one can know what it's like to work in that environment other than the person who's actually doing the work. There's other sources of information, we'll talk about that. But Guarding Minds at Work asks you, as the survey did, asks you, what's it like in your work experience at the University of Guelph?
And to be more specific, unlike any other survey that's out there, this one asks, what is the organization doing to keep you psychologically safe? What might it do better? Where are some issues where it's not doing things it could? It's about organizational action. It's not about your mental health. We're not asking you we did not ask in the course of this survey whether you're depressed or anxious or anything like that. That's not what this one's about. We didn't even ask you to talk about hazards or risks in your environment. We asked about what is the organization doing in these different areas, all these different possible things the organization might do to create an environment that is conducive to your psychological health and safety. So that's the focus of the survey, and that's what makes it unique, because it leads to action. It leads to a direct statement of where improvement could happen at the organizational level.
So if you'll recall, or if you're one of the 30% of people who completed the survey will recall, there are a number of items asking about work experiences and so on, and those relate to 13 psychosocial factors that, as Dan just mentioned, mitigate psychological health and safety and so on. So that's what we're asking about. So in addition to those, there's 39 items pertaining to those. There's an additional 3 items that are very direct, yes/no questions about perceived experience of bullying, harassment, discrimination, or maltreatment due to mental health concerns. So that's the nub of what we're going to be talking about today. Those are the survey results. Okay, you're on.
So that's what the overall output looks like for the organization. Initially, you look at it and say, that looks ridiculously complicated. What does that even mean? So here's what it means. It's not nearly as complicated as it seems. There are 13 of these factors. Each of these factors, we'll talk a bit more about them, is a kind of a dimension or a feature of an organization that might, if it's handled not as well, increase the level of risk or reduce safety. And if it's handled well, can decrease the risk, can mitigate that risk. So the 13 factors that we pulled from literature review and so forth, won't go through them all in detail, but for example, one is called psychological support. And we have a definition for each of these that you'll find in the online material, the report, and so forth. And the definition there is a work environment where coworkers and supervisors are supportive of employees' psychological and mental health concerns and respond appropriately as needed. So we have a definition of what that particular factor means. We'll talk about some of the others. To capture the responses that we got from this community to each of those factors, we broke down the responses to 3 categories. One is the percentage of the people who responded who rated that factor as low in this organization. Those are coming out in red. That's that first part of each bar, the red, which says X%. A certain percent of the respondents rated the organization as performing at a low level on this factor. The yellow, the middle part, is medium. It puts a medium range. We base those cutoff points for low, medium, and then high. We base them on our national normative sample of 5,000 working Canadians. So we had a kind of reference point. So then we get the medium responses, and then the high in green. The percentage of the people who responded who rated this organization as performing at a high level on that factor. So taking that approach, we applied that to each of the 13 factors, and that's what you're seeing in front of you for this whole organization. That's the overall profile. You'll look at that more at leisure. You can, I am sure, take up much of your personal time that otherwise might have been spent with Netflix examining this in more detail.
So bottom line, first of all, it is good news. The University of Guelph, the profile was quite positive in a number of ways. There was certainly some strength that stood out, some areas where collectively you excelled above that normative level and so on. And the 3 of them were, well, Dan just talked about one of them, psychological support. So really supporting individuals in terms of their psychological health and well-being. The next one was protection of physical safety, and that's an interesting one because to some extent this notion of psych health and safety is in some ways an offshoot of occupational health and safety. So it is important to look at how the physical environment, the space, the safety, the isolation, shift work, and so on, impacts psychological health. You were strong there as well. The other area, which in this one really is key, is engagement, the extent to which people are committed to their work and feel it really does make a difference, and so on. You were very high on that. I'll comment on that last factor because that's a really important one, because in many ways that's kind of the engine for change. It's also the engine in some ways for challenge. People are feeling very committed to their work but frustrated by some other kinds of things. But that engagement point really is key. When that isn't there, it's really hard to get any traction.
And it's part of motivating people to put the energy into creating positive change. If you really believe in your work, you believe in your role, you have a sense of how it could be, you want to do it well and you want to do it safely. That is a drive behind a lot of the energy it takes to make change. Because it turns out change isn't easy. I've noticed that in therapy. So it applies to all of us. It applies to everything we do. Change takes energy and determination at the individual and very much at the organizational level.
And I guess on that note, very quickly, the workshop we're doing later this afternoon with some of you and so on is around this change issue.
So let's talk about 4 of the factors in particular that leap out from that profile as relatively concerning, as indicating a fairly high level of individuals in the respondent group saying the organization is not performing that well on these particular factors. That gets you a heads up about factors that you need to pay attention to. The first one is organizational culture. Definition, a work environment characterized by trust, honesty, and fairness. Wonderful virtues, ones we very much aspire to in the workplace, and they make a huge difference in the experience of working within that setting, within the organization. So what the data was telling us was that's a concern area. There's a pretty significant proportion of the respondent group who say organization is not performing strongly as we would like. This is an area for improvement. We want this culture to become stronger and to exemplify those virtues more thoroughly. Another one, clear leadership and expectations. Defined, a work environment where there is effective leadership and support that helps employees know what they need to do, how their work contributes to the organization, and whether there are impending changes. Again, something we've noticed in working with organizations is the issue of organizational change becomes critical here in this clear leadership expectation factor. Organizations going through a lot of change can create a great deal of flux, individual uncertainty, confusion about your role or what the expectations are, and that's where clear direction and clear communication and guidance become critical, even when the organizational change is a positive one. We found with organizations, it wasn't only when the organization was going through a rough time or having an issue of contracting or focusing in a smaller way. It was often when the organization was growing, was doing really well, was thriving, that the stress on the individual employee could be very much intensified and the uncertainty and anxiety of that change could become acute. Workload management, a work environment where tasks and responsibilities can be accomplished successfully within the time available. So it's not just about the amount of work, it's how does that relate? What's the ratio between the amount of work and what it would take to do that job well? When individuals are very time pressed, sometimes what can happen is they're doing their work in a way that doesn't meet their own personal standards of what they're expecting themselves to do. And that creates what's known as moral distress. And it's one of the more powerful factors in the literature in terms of causing people to feel stressed and unhappy and displaced within their work. They have self-expectations, especially highly engaged groups, especially those who really believe in their work. That kind of thing can be a huge source of stress. So it's one of the areas where there's an opportunity for enhancement.
And if I can add to that, in a university setting, I think it's is a seasonal workers. There are ebbs and flows throughout the year. So there are those times where the heat's really on, and then there's times and so on. So a workplace that allows some opportunity to deal with the ebb and flow of the work environment. Okay.
And finally, balance. Growth and development, excuse me, that was the next one. It's a work environment where employees receive encouragement and support in the development of their interpersonal, emotional, and job skills. The easiest one to recognize there is the chance to enhance or train with regard to increasing your job skills, but we also focus in this factor, because it's a psychologically oriented measure, on enhancement of your interpersonal skills, emotional coping skills, what's called emotional intelligence, for example. That is also a critical part of every job that we've got, and the chance to enrich and enhance those kind of interpersonal coping skills, whether at the leadership level or the individual worker level, is also very important. And it's an area where there's a potential here for growth and improvement.
Okay.
What do we got next?
So you explain the index.
All right. So now what we did was, having presented the overall findings in that initial huge chart about the whole organization, the question was, what about the subgroups of the workforce here in this organization? What if we split it in different ways? Are there different perspectives? Do people in different job classifications or other kinds of categories look at it differently? Do they share the same perception as to where the critical issues are? So the first one of these we looked at is employee classification. Now, in order to compare different work groups, we aren't going to put up one of those 13-factor slides for every single different work group. It would just become unwieldy. So what we did was we grabbed the 4 low-scoring items, the ones we mentioned before, the factors of most concern, and we did the immensely complex mathematical operation of averaging them. So we have an average, which creates what we're going to call an index of psychological risk or psychological safety, depending on your perspective. We have an index of how the organization is doing, and that's what we compared the different employee groups on. So let's have a look at that first one, and what we have there is the very striking finding that the academic staff have a much more negative, critical view of how the organization is doing overall in terms of psychological health and safety. The academic group compared to other non-academic staff, compared to student employees of the organization, have a much higher proportion. It was 43% who perceive the organization as really having an issue, really having trouble in this area, and is very much needing to improve and enhance. So the academic staff were the most highly, if you like, motivated to really see change. They're calling for it and they're signaling most strongly. What that actually means is going to be the next stage of focus groups, of discussions, of essentially establishing a conversation with academic staff and the organization to clarify what are the key issues, where's this coming from, what are possible ways of moving forward. Each of these findings leads to a conversation, which does what I call telling the story. What's the story behind this data?
And just to add to Dan's point, being good researchers and curious clinicians, if you will, you want information, you want data from multiple sources, multi-method kind of data collection and so on. So this is one piece of data. We think it's important data, it gives really good directions, but it needs to be augmented by other information, statistics, data from your benefits utilization, all that kind of stuff, and it needs to be augmented with conversations. You folks know what this stuff will mean in your context in a way that we can't, because it's yours.
Okay. Flip on to the next, by location. Now again, we're outsiders. We don't know one of these locations from the other. We don't know what it's like to work in one of these particular areas. There isn't a huge difference among the locations. It's not a very substantial or striking difference, like the distinction between academic staff and other staff. It's not that large, but it's kind of interesting. So there's something about Humber, that sounds like the title of a film, but there is something about that location, but there's something going on where on the one hand you have a higher proportion who see there being a real problem in terms of psychological health and safety. What it doesn't show on the other hand is that group also had the highest percentage who were very positive about engagement. So they saw themselves as most highly engaged and also had the most concern about the psychological safety issues. There's a story behind that. And that's what that follow-up set of conversations is going to be about. What's going on? What's behind this? What story does this actually tell? But we have the initial indicator. There's something here to look into. There's a conversation that needs to happen.
Yes.
Okay. So length of service. There's another story. So here's the story. Somebody is entering this workforce, and in their first 3-5 years, 1 to 5 years, they think it's great. Very low rate of concern. Psychological safety is fantastic. They're really happy. They're seeing lots of positive stuff going on. And then they're here a few years longer, and they're starting to identify problems. They're starting to see gaps. Might just be exposure to an environment. This pattern we've seen in other organizations. As you get to know a place better, you start to see where some of the gaps are, where things should and could be different. You start to see things as not the way they're supposed to be. And you start to be more unhappy about it. You start to say, this is not acceptable. This really needs to shift. That grows a bit. But then as you get people who've been here for 25 years, been here a long time, have a different perspective, maybe they're a little more relaxed about it. Maybe they've come to accept the way it is. Maybe they're a bit more resigned and we need to, get them more aggravated again and ready to make change. Different ways of looking at it. There's a story behind it.
Or they're closer to retirement.
And they say, I can handle this. I'm fine.
Yeah.
I've survived this long. So you can tell that story in different ways, but that's an extraordinary conversation to have with people at different points of the maturity of their relationship to the organization. Imagine if that were a profile of individuals discussing their own personal relationships. And you saw a pattern like that. You'd say, there's something very interesting going on here. What are the issues? Where's the change possibility? So it's a relationship to an organization. Type of employment, not big differences here, which in a way is also kind of surprising. Slight differences, but just not that large between individuals who are full-time on a regular basis and those who are casual or part-time. They tend to see kind of similar perspective on what the psychological health and safety situation is. Not big differences between them, which actually was a bit unexpected. But there you go. Supervisory responsibilities, there really is no difference between the perceptions of those who have supervisory roles and those who do not. They're seeing the organization pretty much in the same way. I found that a bit reassuring. We've worked with some organizations where those who are more in leadership positions had an incredibly rosy view of the whole situation, thought it was just wonderful. And then you would talk to people who are in a reporting relationship and get a very, very different picture. That was more concerning because you knew you had to bring those perspectives together. There had to be a somewhat difficult set of conversations about what's going on here. In this case, you're getting a pretty similar perspective.
And that says something else, I think. It does reflect the reality that people in supervisory or management roles experience the same stress, the same demands as anybody else. So they often get lost in the equation in a lot of organizations, especially so-called middle management. So it really does suggest that programs, initiatives, and so on need to be appreciative and respectful of the experience of those people in supervisory roles.
There's even some literature on contagion, which is a supervisor, a leader who's psychologically not doing very well and is told stressed or depressed or anxious, etc., tends to have people in the reporting team who also become more depressed and anxious and tense. They call that the contagion effect. So it may be incredibly important to engage leaders in any change process.
So as we mentioned, in addition to all the items which reflect the 13 factors, there are 3 items, and they're listed up there, that are simple yes-no questions about people's perceptions around things like discrimination, with the complexity of discrimination, harassment or bullying, and whether they've been treated poorly, perceived being treated poorly because of a mental health concern. Good, this is a good news story. Guelph, compared to the normative sample that Dan just talked about and so on, is equal or lower in many of them. Now, please remember a couple things. First of all, these are perceptions. We don't have the data of specific instances and can't get it in this context. So on. Second of all, you're not going to get to 0. I mean, the reality is you will always, in any large, complex organization, have some base rate where there are concerns about bullying and discrimination. I mean, that's the nature of things. It doesn't mean you need the programs and policies in place, but you need to be realistic about what you're going to expect and achieve. Okay. So we also did, or the survey also asked additional qualitative questions, and we had a pretty good set of responses and so on. We're not going to go through that in particular detail, but we do want to credit you for asking this question. We want to credit the university for having the integrity, frankly, to ask for how can we do better. Please note that the question is how can we improve? It's not, please tell us how wonderful we are. So it's by its very nature, it's going to elicit concerns. And indeed it did. So people raised qualitatively a lot of things which in many cases complemented the quantitative data we just described, but also kind of elaborated in more specific detail of some issues that arose. Okay, great, thanks. These are the main themes. We did a qualitative analysis of that qualitative data and so on, and these were the primary themes that came up. We're not going to go through them in great detail here, given time and so on, though they are in the report and will be shared for sure, so on. It was interesting as well, just a side comment, that there were also differences in job type in terms of which one of these were priorities. So different groups. And I think a general comment about kind of segmented, looking at particular groups is, it really does tell you when, as a large organization, you're coming up with actions or interventions, you need to try and think and tailor them to those groups that may benefit the most or may need them the most and so on. So that, for example, that years of service thing suggests that one blanket policy will have a different impact or be of different relevance to different people depending on their years of experience. I think we did it.
No, we'll flip on this. I think there's another one afterwards. Here we go. This is one of the quotes from the text commentary that I thought was really well spoken, really well said, and worth keeping in mind. What will Guelph do in the future? As leadership changes, improvements are being made. I would like to say keep up the good work and thank you for beginning this process in ways that are actionable and meaningful to me as a member of the community. So remember I talked about this survey being unique in that it's all about organizational actions. It's not about how you need to change or what's wrong with you and you all need better treatment. It's specifically about what's the organization doing here? How well is it doing? What could it do better? It's actionable. It leads to organizational action change. That's what I think is most powerful, and this draws attention to it. The other thing I just want to emphasize is that from our view, from what we've seen, real useful change happens through a collaborative model. I know it sounds typical psychologist kind of talk, but when I work with someone in psychotherapy, I do not have arguments, and we do not solve it through dispute. We solve it through a collaborative, positive, change-oriented method, and I truly believe that that's a powerful method at an individual or an organizational level. And a lot of the stuff we've talked about is aimed towards that kind of collaborative approach focused on positive change.
And I guess to add to that comment as well, what we've seen, we did a research project recently with over 40 organizations as they made changes to improve psychological health and safety in the workplace. It was a fascinating project. And one of the things that came out was what Dan just mentioned. Those organizations that did demonstrate that collaborative process demonstrated more positive change. They also, another key thing to those organizations, and I think it's reflected here as well, is those organizations where there truly was committed leadership to making the change, as opposed to, yes, this is a nice thing, do this over there, but I'm too busy for other things, didn't make a lot of positive change in organization. So, I think.
Okay, we don't know anything else.
Okay.
Thanks, Dan and Merv. Doesn't that sound like a broadcasters at TSN or something? Over to Dan and Merv, you know? Anyway, this session is being podcast as well, so it's out to Ridgetown and other areas and across campus. And if folks do have questions outside of the room, they can send those to Wellness at Work, and we'll pick those questions up. Now, I was going to give a summary of next steps, but before I do that, are there any questions for the consultants? Is there anything that somebody would like to ask them while we're here? And could you go to the mic if you could? There's a, well, in your case, maybe just come forward or stand up because the mic. Yeah, go ahead.
I was just wondering if the report includes statistical comparisons for the within-group comparisons that you make?
Okay, statistical comparisons, meaning did we do t-test analyses or that kind of statistical testing, or do you just mean giving some numbers?
There were some where you commented there wasn't much difference, where I thought maybe there was.
Right, we had a reference sample of 5,000. In this case, we had a fairly large group as well. We run into the problem of being overpowered in terms of statistical comparisons, where like everything. So we really tried to sit back and say, is it meaningful?
Right, I meant within U of G. So for example,
Yeah.
full-time employment versus casual or part-time, it looked like there was twice a double in difference there. But
In terms of the overall, we didn't have the overall mean on there, but you mean in terms of proportion in some of the categories, like the low category. Don't think it was double, but it might well still have been statistically significant, because even here, that's a fairly large sample. But we just tried to step back and say, is this difference striking? Is it meaningful? Does it look like an actionable difference?
The other thing I'd like to stress on that point is all of these factors are important in their own way. So we don't want to say just look at the areas of concern or the strengths and so on. Pay attention to, as the university moves forward, all the factors. There may well be, I'm sure there are initiatives that are priorities and so on, and they may be coming from the factors that didn't jump out as risks, but nonetheless things to pay attention to and move forward.
Yes.
The 29% completion rate, is that about what you would have expected?
It's very good for an online survey, quite candidly. We've done work with other organizations where it's been 14, 15% or even lower and so on. Needless to say, it's a great question. The higher participation rate, the greater trust we can have in the findings. We feel pretty good about this one, quite frankly. I think that's fairly impressive. And again, is a demonstration of interest and commitment and, frankly, obligation to do something about it.
Way over here.
you ever done this kind of survey at a different or other post-secondary institution?
We've done variants on
Could you
this.
repeat the question? I'm not sure.
Oh, I'm sorry. Have we done this survey at other higher post-secondary institutions, so on? Yes, though I wouldn't say it was this survey. This one was customized for your purposes, although some of the items, particularly from Guarding Minds at Work, were used other places. I don't want to use names necessarily. I think some of them are in our bio. But yes, we've worked, and we are in universities as appointments and so on. Have encouraged our own universities to participate. So the answer is yes.
What we don't have yet is an adequate reference sample within that subcategory. And that, over time, I think will emerge as organizations are willing to share their data. It would make sense to want to put that together. That would have to be organized by, and what's happening now is we're being approached by organizations who combine a whole sector. So we have healthcare, which has an overall healthcare organization, which is now putting together the survey data. We have first responders doing that as a sector. It would be great to have post-secondary institutions do the same thing at a sectoral level.
And that might be a suggestion, quite frankly, Sarah and Melissa, for the University of signed up for the Okanagan Charter to look at the data they've gathered, what methods. We know some of them are using guarding lines at work and other instruments. Start to build that database.
Someone else? Anyone else? Yes, go ahead.
I have a question. Are the respondents representative of the demographics of the university as well?
Reasonably well, to the extent, demographics by, if you go full detail, gender, age, and that, we can't kind of do that because we didn't segment it that way. But in terms of the segments we just described there, yes, there was a pretty good representation across employee groups, across types of employees and so on.
In terms of the response rate. So
In terms of response
participation rate was at least comparable across these different areas. If we had one group with a 1% response rate, that would obviously be problematic. But it was enough that we felt comfortable with it.
And we wouldn't have done the analysis of those small groups if there wasn't sufficient number of respondents. Okay?
Anybody else? Good. Okay, so slide says what's next, and both Merv and Dan touched on what's next, but I just want to reinforce and explain to you what we're planning to do next. So the recommendation is to communicate results. So obviously that, what is this about? This is what this event is about today. And I'm very appreciative of upwards of 300 people being here today. That's tremendous and is indicative of the interest that you have in what we're doing here. We met this morning with employee group leaders, about 20 or so, and we will be sharing results for each employee group. So the employee leaders will have specific profiles on their group so they can see how their employee group responded to the survey. Provided that that employee group, there was more than 10 respondents to keep this anonymous. So there's a couple small groups that, employee groups that are 10 or less, so we will not be able to share information with those folks. So we have completed a dashboard. We'll have copies of this. We'd like you to take as many with you as you can. Hits on some of the highlights that, we're talking about today. We will post, is it up already on the web? Okay. Today, tomorrow, on the Wellness at Work website, we'll put up both volumes of the survey. You only saw a very, very small sample of information. The statistical analysis is upwards of 60 pages of information for you. So you'll have lots of opportunity after work hours to look at this. Okay, so that's some of our plans and communication. We talked about a change readiness workshop. This afternoon, the deans, the assistant vice presidents, department leaders, a group of about 40 individuals will be going through what we call a change readiness workshop that Dan and Merv will take us through. And it's preparing ourselves for change, or how do we go about change? How do we take a look at what we've learned from this, from these surveys to date, and what are some of the methods and ways that can we tackle some of the issues that have been identified through this survey. Looking forward to that this afternoon. Excellence Canada. We've joined and are a member of Excellence Canada. They're the renowned kind of leader in healthy workplace principles. Several universities have belonged, and they have a very structured process of determining that your policies and procedures do support a healthy workplace. And we're completing, as recommended in the review here, an organizational review of our workplace policies, procedures, and some of those have, many of those have already been completed, and many of you have been involved with reviewing those and providing your input, and we'll continue to do so as we go forward to incorporate what a healthy workplace should be, not only from a health and safety perspective, but from a psychosocial perspective as well. We are committed to supporting the entire individual, the whole individual. Fourth, we talked about focus groups. We will invite some of you, I made this commitment to the employee groups this morning, to talk about these results. So in the next while, we'll continue to have a conversation and to gather your input about your perceptions, your opinion about some of the results that we've obtained. And finally, it's not all about concerns, it's also about celebrating our strengths. And what didn't come across in a great way here today, but you will see this in the report, there are a lot of strengths. We talked about 3 that really stand out, but it's interesting to point out that 85% of respondents said the university supports their general health. That in itself is something to celebrate. 67% felt the benefits meet their needs, another encouraging sign. And 91% feel they have the opportunity to work safely. And it's my personal goal, and I think of this not only from our perspective of everyone sitting in this room, but the thousands of students that we have here every day, that I want us to be renowned and known as the safest campus in Canada. I do appreciate the support of the president, and he's been very encouraging and has been a champion of this and continues and wants to be a champion of this process. The Wellness Committee has been very committed, very eager, very good people. There's been a lot done already in the last year or so. We have recruited champions. Maybe some of you are those champions. I think we have upwards of 60 champions. These are people that are in various workplaces that have decided and want to champion wellness in their work areas. So thank you to those that are involved. We're always looking for more, and it's up to you. You want to champion, you champion what you can, and let us know what you're up to, and if we can help, that's great. We did have a very full-packed month of October. Many of you participated in wellness activities, and we do have a programming committee that will continue on and providing more information. We do have a Wellness at Work grant program, so we're accepting applications, and I think they closed the end of March. They're closed now, so we'll be looking at applications from people that have come forward, some champions, whatever. We want to do whatever in our workplace. We want to do this, but we need this. And we do have some financial ability. We will be able to support some of those initiatives. I'm hoping many of those will partner several departments, and they'll be able to work together on some of these wellness initiatives in those workplaces. The website is comprehensive. If you have a chance to look at it, there's also a lot of activities. It's amazing what goes on here. The Wellness at website brings those all of those events, or as much as we can, the wellness programs, the upcoming events, news and updates and resources together. That's where you'll also find the survey results. If you go there, you'll be able to take a look at the survey results. I want to take this opportunity to talk about another initiative we have planned. We plan and hope to move forward. No, we will be moving forward with a smoke-free campus initiative, and I'm providing a lot of lead time here to socialize this with you. It's our plan to do that probably in a year from now. We understand there's some challenges for some people if we proceed with this smoke-free campus initiative, and we have to be respectful and helpful with for those people. So this is happening quite a bit. I think it's probably been driven to some extent by cannabis legislation, but regardless, lots of schools are moving in this area, and I think it's time that we pursue this as well. So I'm only putting this out today as an introduction to a conversation that we'll have over the next year about a smoke-free campus. So with that, are there any questions that you might want for me? No? Okay, Bill, he's just heading off, I guess. Okay, so, okay, yeah, Bill.
Hi, Bill Cormack, President of Faculty Association. I have 2 questions based on the high-level results. First one had to do with psychological safety and the fact that faculty and academic staff suggested very little confidence in that on campus. And based on the experience of our members with the Occupational Health and Wellness Office, where they've often been told that the most important thing is satisfying the demands of Sun Life, First question is, can we expect that to change and more consideration to be given to mental health crises to faculty and academic staff? That's the first question. The second question relates to the other element on the high-level results that showed faculty and academic staff had very little confidence in the organizational culture and leadership of the university, and I'm wondering what the university intends to do about that.
I can answer the first question. We did complete a review of our occupational health operations earlier this year. They have made some suggested changes. There have been some changes made already, and there will continue to be changes made to respond to the concerns that were raised by folks. And that'll take a bit, but for example, the medical team that's involved has changed, and we will be engaging more professional services to help in the area of mental health, definitely. Second was culture?
Leadership.
Leadership. Yeah, that's a more complicated conversation, and I did like Dan's response, and I think that's one that we can't resolve ourselves. We have to work with everyone to resolve that question. So I think as we go along here, there's a commitment from all of us to work together to deal with that issue. I think definitely that'll probably be a topic of conversation with the senior team this afternoon, and it certainly, I expect, will be a conversation when we meet in focus groups. And let's talk about how we can create trust, build relationships, and improve leadership.
Hi, Don. Herb Kuntz, the Vice President of the Faculty Association. So workload and trust in senior admin seem to be two things that stood out in the survey for the faculty, the academic staff piece, right? It may be the case for other employee groups as well. I'd like to offer a narrative. Back to Monday, I was at the budget town hall, and on the slides, the provo was talking about the growth of the set-aside money, the internally restricted money to $320 million. I don't want to get in the weeds with the question, but forgive me. To $320 million, championing or saying, you know, this is an accomplishment over the last 8 years. This is your other hat, Don, so you know. Indeed, going back to 2009, the internally restricted money doubled to $77 million. It's grown to $320 now. What I did at the town hall was look at the CUDO data, that is the admin data. If we go back 8 years, the number of students from then till 8 years later has grown. The full-time students, all levels, domestic, international, has grown 37%. Faculty, from 8 years ago to then, has gone down 4%. We did have a 3% growth in the year that's not on the CUDO data set, so maybe we've broken even with 2009, but there's 37% more students. That's perhaps a function of the $320 million being set aside and growing in my mind, and seeing this report and the workload stress seems to also be a consequence of that to me. That's my narrative. And whenever I bring up the set-aside money, the pension boogeyman is held up, and that's our other hat that we share. On Saturday, we'll be in sweaty rooms together at the hotel for the mediation on the UPP.
Right.
So when, because I believe it will be successful, the UPP is entered into, this is the pension plan joint with Queens and Toronto, all the employee groups that are, and there's representatives in the room working on that, and hopefully others that are also going to get involved again. When that is a success, and the pension plan has been consented to and it will exist, suddenly that boogeyman of the solvency payments will disappear,
Right.
and you have $320 million set aside, always held up as being needed for pension. Can you make some sort of commitment? I know I can't get anything in writing and quantified and so on, but will that money be used to increase the faculty complement, maybe the other staffing on campus, to relieve the stress of the 37% student growth that was never properly resourced?
Right. Good question. Stop that, John. The reserves that the university has on its balance sheet right now are they're a mix. There's some that's restricted in that we have to use these monies for certain purposes, as you know. That is for OMAFRA support and certain research projects and that sort of stuff, so that plays into that. So there's a certain pot of money that we can't touch because it's not ours to touch. It's on our balance sheet, but we have to use it for certain purposes. There are other funds that have been allocated and grown over the years that do have some flexibility in it, but the colleges and the university has earmarked those funds for certain purposes as well. But there is some flexibility in that going forward. So that, I think, is around $65 million, if I remember correctly. And then there is a reserve that's been established to help us with pension. So we have been trying to save some money because of the pension obligations that we have in front of us. So we just presented the the budget to the Finance Committee this morning, and I pointed out to them that right now the contribution to pension by employees and by the university is $90 million a year. It's atrocious. 34 million of that $90 million, 24 million of that is contributed by employees. The remainder is contributed by the university. Normal costs, which would be matching similar to what you folks invest. We all invest, it's my pension as well. But over and above that, because of the financial status of our pension plan right now, we contribute, the university, an additional $34 million into those pensions because we have to fund those over a period of time. If the jointly sponsored pension plan is successful, and we're in conversations with Queen's and the University of Toronto about moving forward with this plan, 22 million of that $34 million is going to what is called solvency, a special accounting of pensions that's called solvency. If we join a special, merge our plans and become a jointly sponsored plan, we're exempt from solvency payments. That would mean, because our solvency right now, the deficit of the plan is $600 million. Huge. That is no longer an obligation if we become a jointly sponsored plan. Excuse me, that's a condition of us becoming a jointly sponsored plan. That means that we will free up, hopefully, $22 million in the budget. And we're getting close on the other, on the going concern basis of what the plan might be. So to answer your question, to provide some background, I can't make any commitment about where those monies would be, but it certainly would allow some flexibility, some opportunity to change, because we wouldn't have that obligation that we have today to our pension plan.
I appreciate that. I would not mind down to the 22 million of the 34 that's solvency. To
Yes.
me, the bucketing of the 320 million that's internally restricted, not externally restricted, the bucketing of that into the categories it is now is completely artificial. There's no transfer plans, transfer payment plans, transfer plans, contribution plans, anything associated with that money. It's just labeled as you've labeled it. So
Right.
to me, all that money is set aside, taken out of operating that was originally directed towards the missions of the university, got shifted out, and has never been put back to its original intended use. So I wouldn't accept an argument that 22 million of the 320 is possibly going to be on the table. I would expect more,
Yeah.
and I will push for that when the time comes.
And I wouldn't disagree with you. I won't say how
Agreed.
much that might be, but the other side of this too is you see a lot of construction going on here.
Oh, no,
Money's going
totally.
into those
I
things.
understand,
So
I
it's a
understand
balance
there's
of a whole
other
bunch
things
of things.
needing money.
Yeah.
But the human
Yep.
price of that growth, because, you know, the two consultants talked about organizations growing. Yeah, we've grown on one side, not on the other.
You're right.
Right.
Yeah.
Thanks, Don.
Any other questions? It has to be an easy one.
It's not, well, it's probably not, but, so it's Sarah Whelan, Vice President of Steelworkers on campus. This morning in the meeting, and then again today, you touched on those three, perceived discrimination, harassment, and it was compared to a national standard, I
Right.
suppose. And so I understand that we are not, are low or slightly above the national standard. But still, there was nothing mentioned about if, moving forward, what is the university's plan to mitigate that perceived discrimination and harassment? Because it was about 10% of the people that responded, which is not an insignificant amount.
Right.
so.
Yeah. Yes, I guess we're doing better than most, but there's still a problem that has to be dealt with. I can't give you an answer to that. There's a lot of resources in place here now, but working together with those resources and the initiatives that we have on both the student side, which has been fantastic, as well as what we're doing here in human resources and other areas, yeah, that's one of the areas that has to be given further consideration for sure.
Can I add a comment to that, if I may? I appreciate the point. You're absolutely right. Just because you're somewhat low, there, as we said before, there's going to be some, doesn't mean you can't do better. In addition to have the programs and policies in place, we found a number of organizations that may well have good stuff in place, but people don't know about it or use it or trust it. So part of the whole process is also ensuring that those programs or people, the staff, know about them, trust them, and use them.
Thank you very much.
So we're losing folks, so I'll just thank you very much again for coming. I really appreciate it. I'm going to give it to the president here now to close things up.
Well, thanks very much, Don, and let me again thank all of you for participating today. I do want to take this opportunity to recognize both the thoughtfulness and the professionalism of our consultants here. I have to say, in my interactions and the feedback that we've received, Dr. Merv Gilbert and Dr. Dan Bilsker have done just a terrific job, and I just want to again thank them and recognize for that. Absolutely. I want to also thank Don O'Leary and the team, again, the Well Said Work Advisory Committee, and all of you for your participation in this. This is incredibly important to us. This is, it's really in many ways a bit of a starting point or a reset, if you will. These are ongoing conversations. You know, the point about harassment and discrimination. These are ongoing conversations that I actually think don't have a beginning and end. They need to be part of our core sense of ourselves and an ongoing conversation as we go through the ebbs and flows of our community. So this has really been an opportunity to understand the landscape a little bit better, understand our vulnerability spots as change becomes increasingly the order of the day, not just in our institution, but around us. And we've heard a couple of highlighted points around the importance of communication. We've heard about the importance of workload. And how workload has been impacted because of the evolving context that we work within. I do want to recognize also an appreciation for the combination of quantitative and qualitative analyses. I don't know, maybe this is just me getting older or something, but as someone who's spent most of his professional life in quantitative analyses as a neuroscientist in my own field, I have increasingly become appreciative of the absolute criticality of qualitative analyses, because this is where you capture the nuances. This is where you capture the texture of the community, and the thematic analysis is a somewhat structured way of doing that. So that combination of both quantitative and qualitative, I think, is important. So I want to thank you for that, and I think that's part of the thoughtfulness. Let me also say we have plenty of reasons to celebrate. There's a lot of very, very good things that are happening in this university and that speak extremely well to what I would call the long-term sustainability and viability of the university. But I will also say that at the same time, this forward momentum, and we're seeing it in all sorts of ways. We see it in the success of our grants. We see it in the emergence of new programs. It does come with a cost. And I think I have to say that I'm very buoyed to see, first of all, the engagement that people have, and also I hope that people appreciate the transparency and the openness that we want to get this conversation going on that sense. So much of this is about managing and adapting to uncertainty, and some of you have heard me talk about the upside of uncertainty and the downside of uncertainty. Downside of uncertainty being fear, angst, how to manage as business cycles, as university cycles become more and more frequent and shorter. How do we how do we adapt to the increasing frequency of disruption? Disruption has always been around, but the frequency of disruption, I think, is somewhat unprecedented. And in many ways, a lot of what this survey for me is thinking about how can we create a conversation, how can we create a process that speaks to the upside of uncertainty. And what's that? It's hope, it's discovery, it's being energized and being able to move forward and reducing that sense of perceived angst as change continues. So it's about, in a sense, readapting to this new pace of change that is increasingly becoming our realities. And I do see many of the issues or items that represent challenges as I think being I would say to some extent side effects of that context and that reality. And today was really all about really demonstrating our commitment to recognizing that, yes, celebrating our successes, but at the same time recognizing the journey and what it means for the journey. And increasingly, and you know, my team has heard me talk about journeys versus destination ad nauseum, but the journey really is becoming the destination. I mean, how we work. If we were to predict where are we going to land 5 years from now, 10 years from now, 15 years from now, it's getting so hard to predict. It's getting so hard to predict, and therefore, almost by default, how we work and that journey actually becomes an increasing necessity in terms of the focus and importance. If we're on a good journey, if we're traveling in a good way, we will get to good places together. And on that note, I want to say thank you to all of you again for all your support and help through this process. Thank you.